Good afternoon, everyone, and welcome to today's Food for Thought seminar. My name is Tasila, and I'm part of the Food for Thought team. Before I introduce you to today's speakers, I'd like to remind you of some housekeeping information. As this is a Microsoft webinar event, you can't unmute yourself or come on camera, and the chat function is disabled. We welcome any questions you have. Please feel free to post them in the Q&A chat box, which should appear on the right side of your screen. Please note that any questions will be picked up at the end of the presentation, but feel free to ask questions using the Q&A box as we go along, and we'll come to them at the end. We're always looking for recommendations of speakers to invite, so if you have any suggestions, then please let us know at our email address, which is foodforthought@food.gov.uk. For today's seminar, I'd like to provide a very warm welcome to our speakers, Professor Maria Bryant, Dr. Sundus Madhi, Nicola Nixon, and Rob Oxley from the University of York. Maria Bryant is a professor of public health nutrition at the University of York, with over 20 years' experience in trials and applied research on food diet and obesity. Her work focuses on public health interventions, food systems, food insecurity, and school and early years nutrition. She holds multiple leadership roles, including Director of Diet, Nutrition, and Obesity Research for Born in Bradford, and academic director of the Born and Bred in Network. Dr. Sundus Madhi is a research associate in the Department of Health Sciences at the University of York, working on the school's food workstream of FixOurFood. Her research focuses on food policies that improve children's diets and reduce health inequalities, with interest in whole system approaches, school food settings, public health interventions, and behavioral and economic aspects of dietary change. Nicola Nixon is a research associate and PhD student in the Department of Health Sciences, University of York. Her research focuses on how school food procurement can impact health and well-being outcomes for all children, working towards a more equal and healthier nation in conjunction with regenerating our natural environment. And finally, Rob Oxley is a research trainee in the Department of Health Sciences at the University of York. Rob has a strong interest in reducing health inequalities and improving health outcomes, and is currently working on the auto-enrollment of free school meals with work streams of FixOurFood. Rob has previously worked for Northumbria and Teesside University on various public health research projects, including Bring It On Bram, a holiday activities and food program aiming to support children throughout holiday periods. With that, I'll hand over to our wonderful speakers to give an overview of the work carried out by the FixOurFood in Schools team and to share some of the projects they have recently completed. From all of us at the Food for Thought team, we hope you enjoy the presentation today.
Thank you for that wonderful introduction. So I'm really delighted to be here on behalf of the FixOurFood team to present the work that we've been doing probably over the last 4 to 5 years now, focused on early years and school settings, and today's about school food. So next slide, please, Nicola. Thank you. So this work has been conducted as part of a wider programme of work called FixOurFood. It was one of the UKRI Transforming Food Systems programmes, and it took a place-based approach, so it was focused across Yorkshire and the Humber. And the idea behind this programme was for transformation of the whole food system within 3 subsystems. So we've got regenerative farming, hybrid food economies, and the early years and schools settings. And if you wouldn't mind just clicking, please, Nicola. So within the early years and school settings, right at the very beginning, what we did is set out our vision for the 5-year programme, but using that on a 20-year vision, if you like. So with this, we said that tasty, good quality, sustainable food is the default and the easiest choice for all children. But actually all the work that we have focused on very much is about ensuring those in greatest need are not left behind or alienated. So much of the work that we do focuses on children in greatest need. So today we are going to provide just a snapshot of some of the work that we've been doing. Of course, we're happy to talk about other work as well, and we're going to share this amongst the team. So I'm going to pass you over to Sundus now.
Super, thank you so much for Maria. So starting in 2020, so before we commenced with any major research activities, we set up the Leaders for Change initiative. So this empowered young people to become active agents of change in the food system. Nicola, if you can just click. It engaged them as citizen scientists and researchers to set priorities for food system transformation and improve school food systems for better health outcomes through student-led projects. We also engaged with over 300 young people to understand their school food priorities, which helped us direct and focus our own research activities to areas that young people deemed important. So shortly after that, we set out to support Yorkshire primary schools in the provision of healthy and sustainable school meals. And we did this through a 5-year-long project that consisted of school observation days and building a school network and database of key descriptives surrounding school food systems. Now, observation days consisted of school visits, observing the school food environment and interviewing a member of the staff leadership team, and also talking to a group of children about their views and understanding of school food. And the point of all of this was to collect diverse and rich data on whole school food approaches. Now, Professor Maria Bryant will provide an overview of our early findings later on. In 2021, we undertook an evaluation of the Healthy Activities and Food Programme, which investigated the implementation and impact of the scheme through a mixed methods approach, consisting of child survey outcomes, interviews with local authority stakeholders, and parent interviews. Following on in 2022, the Free School Meal Allowance project kicked off, which aimed to investigate whether the free school meal allowance was sufficient to purchase a healthy, tasty and sustainable meal through a citizen science approach. Now, this trains secondary school pupils to undertake research activities and collect data themselves, in addition to participating in focus groups. In 2022, we also had a PhD project commence focusing on school food procurement, and this aimed to explore the impact of the procurement contract type on the quality of the food provided in schools, and Nicola Nixon will go into this in further detail. In 2023, we were provided with additional funding to undertake an implementation and impact evaluation of the Free School Meal Auto-Enrolment Action-Oriented Programme. Now, Free School Meal Auto-Enrolment is a new method adopted by local authorities to boost free school meal registrations. So this is where local authorities use welfare data sets to identify entitled but not yet but unregistered families who are then automatically enrolled unless they choose to opt out. And Rob Oxley will discuss our latest findings and the tremendous impact generated through this project. Moving on, in 2023, we also undertook a case study of food procurement and provision in early years settings within Yorkshire through mixed methods, including a literature and policy review, semi-structured interviews of key stakeholders, and menu analysis. And in the same year, we also utilised data from our school observation days and interviews, Nicola, if you can just click, to produce a focused report on breakfast clubs. And now this generated an understanding of how breakfast clubs are delivered, what sorts of foods are provided, and the constraints and benefits of delivery. And finally, in 2024, we began the Menu Swaps project, where we've been working with Bradford City Council to implement subtle but healthier changes to menus within Bradford primary schools. And Professor Maria Bryant will discuss this further. Over to you, Maria.
Thank you. It kind of explains why I feel like we're so busy. So yeah, lots of work there. So I'm going to, at the moment, talk about the observation days and give you some insights in some of the things that we have found. So next slide, please. So as Sundus has said, we conducted observation days across primary schools, and we really wanted to understand what was being not only offered to children, so what was being served, but what they choose, what they eat, and what they waste, and within a context of the food environment and other policies and things like food culture in the schools. So we recruited 25 schools in which we have detailed information about food consumption, as I said before. And of those 21, we've done a full day's observation. So that includes researchers being there from breakfast club all the way through the day and then after the school. So in those schools, we also conducted interviews with head teachers and we ran focus groups with children as well. And we sampled these schools as much as what we could across Yorkshire to get a good variability in terms of things like geography, so rurality, ethnicity, and also deprivation by looking at the free school meal eligibility quota in each school. And then in addition to these observation days as well, we also conducted surveys. So we sent these out across, again, primary schools across Yorkshire and Humber, really exploring some of the policies and practices, which we then combined with routine data that's available on the schools as well. Next slide, please. So in terms of the food intake, then we used a photographic method for this. So you can see from the photos here, we've got a picture of before the child has eaten and then again after when they're finished. And while we're in the schools, what we do is we weigh a standard portion size of all of the foods that are available to the children. And so what happens after this with all these photos is that we've worked with a dietitian and a nutritionist who visually estimates how much food there is, so the size of the portions compared to the weighed pictures, and then the proportion of that is consumed from the after pictures. And we've done some inter-rater reliability testing just to make sure that those estimates are consistent amongst people. Now, as you can imagine, this is an awful lot of work. So at the moment, we're in the process of testing to see whether or not we can use a visual AI technology, and we're crossing all of our fingers and toes for that. So we've completed all of these now. So we've got 9,249 before and after photos. So that's for 4,624 children. And everything is being inputted into quite a large database. We're actually working with Nutritics. And so we can capture lots of information. So we've got macro and micronutrients. We can look at environmental metrics as well. But we're also able to look at things like food, so different food intakes, perhaps things on ultra-processed foods, and also whether or not schools meet school food standards. And you're going to hear a little bit more about that later. So today what I'm going to do is provide findings of data from 3,481 photos. So that's 1,605 children, and that's across 11 schools. Next slide, please. I hope you can see these. They look a little bit small from me now. So what we're showing you here is some information on the consumption and data, and we've got blue bars for the food that's for the served portion of the food, and then we've got the red for the actual consumed ones. And so these are based on a percentage of the recommended daily intake. And what we've done is we've used the lunch period, suggesting that that's 30% of an overall intake across the whole day. So the dotted line is 100% of the recommended intake of 30%, if that makes sense to you. So I guess the first thing to note here, and it may seem obvious, is that we've got a higher amount of offered than consumed, because of course not all children eat everything on their plate. But this is important because we're thinking about monitoring. We're often looking at what's being served and not what's being consumed. So just glancing at this, then you'll see that there's too much offered and consumed free sugars and too much protein in the school meals that we looked at. Fibre looks okay when you're looking at the served, but when you look at what's consumed, it's under recommendations. Anecdotally, looking at the pictures, we think that's vegetables, but that's something that we need to look into a little bit more. So we've got sodium that exceeds in served recommendations, but is okay in consumed. And you'll see that generally there's quite a low intake across a lot of the nutrients, including energy and some of the micronutrients as well. Next slide, please. Okay, so just looking at some of the foods then, in terms of fruits and vegetables and potato dishes, this is just served, by the way, at the moment, but for the same number of children. What we can see is that less than 20% of children are served any form of fruit in a given day on the day that we were there. And that's kind of the case for whether it's fresh whole food or whether it's sort of in a fruit-based pudding, for example. But most of them are getting served vegetables, and the majority of these kind of sit on the side of a plate. So you'll have like a protein source and then you'll have some vegetables on the side. We've also looked at composite vegetables. So in other words, vegetables that are put into meals. So things like lasagna, for example, and veggie chilies. And that accounts for about 26% of meals that were served. That doubles if you include pizzas. So if you're happy to say that tomato base for a pizza is part of that vegetables, then that makes up quite a considerable difference. And potatoes are quite common. So we see these over 50% of the carbohydrates that are served are potatoes. Next slide, please. Looks like I've got, oh, there we go. So in terms of the wider observations then that we capture, this again is across the full day. So we'll be looking at things like the fruit and veg scheme and finding out what people think about those, how it's kind of implemented. We're looking at the whole eating environment as well. And we're also thinking about things like policy, so packed lunch policies, whether children who have packed lunch meals are able to sit with their friends who are having school meals, for example, what the water policies are as well, what the outside area looks like, and things like food curriculum. So what does that look like in terms of learning about food and perhaps learning even with food as well. And as we said before, interviewing all the head teachers or a member of the senior leadership team and a focus group for the children, really thinking about what they like, what they don't like, and things that come up over and over again, portion sizes and queuing. That seems to be one of the key themes that comes out. Next slide, please. So all of the schools that we visit, we send a report out based on all of the data that we collect across that day and the surveys that they're also asked to complete. And we try to do this positively. So we talk about what we've seen, what was great, and then we look at the data in detail and we analyse that according to a whole school approach to food framework that we developed out of a project called Connects Food. So some of the things that you see here, these are our principles for whole school approaches to food. We, for this project, added on environmental sustainability as well. Next slide, please. And so each school gets the letter and then it gets a table according to each of these principles with information, specific information about what we saw and then some recommendations. And so although I guess this is quite small for you, on the left it's the principle of senior leadership. On the right we've got eating environment. And so for example, I think there's something in the senior leadership about making sure that it's a governor whose responsibility is to have school food. Next slide, please. Okay, so you know, we are using our data really for many different reasons, and we're able to sort of get to them quite quickly. So if there's emerging priority areas, whether it's a policy area or something else, we're able to capture information across all of the data that we're collecting. So this is just an example, the report that we published for breakfast clubs during the time that the manifesto was being developed for Labour. We used data from 17 schools at that point, again, across the whole day. We analysed it according to the Connects Food framework. And essentially what we found with this is that in terms of breakfast clubs, none of them have a menu. There's little variation in terms of the food. It tends to be bagels, toasts and cereal. And when we speak to people, the biggest barrier for quality or perceived quality is cost. But all of the schools provided free breakfast if parents weren't able to pay. And overall, data supported the importance of breakfast in terms of eating, socialising, opportunities to build nutrition quality, all children treated equally, and a benefit to working parents as well. Okay, so I think I'm going to pass over to Nicola now. So over to you.
Hi, as Sundar said, my research looks at the school food procurement methods that we have and the impact that has on quality. And since devolution of responsibility for school food away from local authorities in the 1980s, school leaders have been free to choose their meals provider. However, there's no requirement to report this to anyone and no central record of who provides our meals in England. I undertook a scoping review of existing evidence, and that revealed that there's very little evidence on the merits of using one particular provision type over another, and that there's no universal definition of quality for school food. Compliance with standards was often used as an available proxy, and in England, responsibility for compliance with our school food standards rests with the school leaders and school governors. However, using our FixOurFood school survey, it told us that only 6% of schools had a governor responsible for school food. In addition to a lack of potential oversight in the school, there's no robust independent method of monitoring compliance to standards in England, and the recent FSA pilot highlighted that even if we did have better monitoring in place, there's no consistent support to address any issues found. All of this would indicate that the caterer often has the key role in influencing the quality of school food. Given that we've no public oversight of who's providing the meals, if we want to optimise the considerable public sector investment in school meals to address health and inequalities, then we need to ask ourselves if we really know what our children are being fed at school. So I set out to understand who provides the meals using a case study in Yorkshire, a very diverse county representing 10% of primary school children in England, with almost 1,800 primary schools across our 15 local authorities. We sent a survey to schools, and many public health teams and caterers kindly shared their provision lists with me. And then finally, I looked at the websites for any remaining schools where I didn't have information. And I quickly found out why no one has done this before. It was a huge task, and it took about 18 months, and I still only managed to get about 88% of the data. So these blue circles represent the primary schools in our 15 local authorities in Yorkshire. The bigger the circle, the more schools in that authority. And as you can see, this varied widely from the smallest circle representing just 47 schools to the largest representing 298 schools. And those schools also varied widely in size from just 5 to 789 pupils. Then looking at who supplies their meals, approximately half were serviced by local authority caterers, represented by these light blue circles. And this is where the local authority has its own catering service to provide the school meals, noting that the way they operate can vary between local authority. They might subsidise this from public funds, or they might be required to cover their own costs, or some even have to generate a profit. And they might be a local authority department, or some are run as a separate legal entity. So already it's complicated, and this complexity increases with cross-authority supply, 5 local authorities no longer having any catering provision at all, and 1 having a hybrid service in collaboration with in-house catering teams. Then just under a third of schools are serviced by commercial caterers, represented by these yellow circles. This is where a private commercial entity is contracted to provide the meals, usually by the school or academy trust, but it might also be by the local authority. And just 5 companies service almost 78% of these schools in Yorkshire, often supplying schools in numerous different authorities. And we've got 1 local authority that outsources its provision entirely to a commercial caterer. We then have the in-house provision, which is represented by the red circle. And this is where the school employs its own chef or cook, which is approximately 1/10 of provision. And with this map complete, we can really see just how complicated and fragmented supply in Yorkshire is. If we look at how this has changed in the last decade, the last set of data was taken in about 2013 for the school food plan. So if we look at the pie chart on the left, that shows what it was like at that time, and the pie chart on the right is what it is from my research. So we can see a mass migration away from the local authority service, which is the blue slice. That's fallen from 82% to 49%. And as I said earlier, this has left 5 of our 15 local authorities without a viable service and 2 others with a hybrid service. The commercial provision, the yellow slice, and the in-house provision, the red slice, have more than doubled. And it's probably been influenced by the academisation of schools over the last decade, which has increased from 7% to 48% now. And it's also interesting to note that we've now got a green slice, which is unknown, and that was 12% of schools. So how can we effectively influence what we really don't know? I also compared the characteristics of the schools for size, deprivation, geography and ethnicity. I used English as additional language for that, by the three provider types of local authority catering, commercial catering and in-house provision. And that's because these are key indicators of the financial viability of the service, with meals in larger urban schools having the ability to make higher profits because of economies of scale, higher meal uptake, and also additional pupil premium coming from the free school meals. Looking at the difference in characteristics by provider type, the headline findings were that local authority caterers have been left with the smallest rural schools with the lowest deprivation and profit potential. Historically, they would have managed the provision as a whole, using the large profitable schools to subsidise the small ones, which can't break even on their own. By contrast, the commercial and in-house caterers had more of the schools with better profit potential. School leaders are now able to secure better deals from the commercial providers or take the provision in-house so they can keep any surplus profits to support their own school budgets. And it's important to note that 372, or over a fifth, of schools in Yorkshire had less than the 150 pupils needed to break even, and the majority of these were local authority catered. The influence of academisation stood out in this data, with academies less likely to choose local authority caterers. I then went on to interview key stakeholders from all of the procurement contract types, along with national stakeholders and suppliers, to try and understand what they believed impacted the quality of meals provided. And headline findings were that the power dynamics were very interrelated and complex. Caterers were highly influenced by what they perceived children wanted to eat, which in turn was thought to be influenced by the food environment and what they ate at home. In practice, this translated to caterers believing that ultra-processed food was poor quality, but serving it often, either through a concern that children would be hungry or to increase uptake and keep costs down. The public health teams felt powerless to oversee or enforce quality of food served. School leaders were key to quality, but whether they invested time and resource depended on their interest in school food. And the different catering models all had different drivers and motivation, but consensus was that good and poor practice was possible and evident in each of the three provider types. The school food standards were felt to be ineffective, misunderstood and easy to manipulate. In addition to the lack of monitoring, there was confusion over the requirements. For example, what is a starchy food cooked in fat or oil? Common practices identified were serving unpopular or expensive but compliant dishes such as oily fish alongside pizza or fish fingers, because caterers knew that most children would choose the cheaper convenience food. As we saw earlier, the economics were highlighted to benefit large schools who could make good profits and use the surplus for other budget areas, whereas the small schools were not financially viable. And the system was too reliant on the dedication of individuals who had a lot of responsibility for what was usually paid on or around the minimum wage. So I'll hand back to Maria now.
Thank you, Nicola. Okay, so I'm going to talk about a project that is ongoing at the moment. It's what we're calling our menu swap study. So you can go on to the next slide straight away if you like, Nicola. So this started a little while ago. We were approached by Bradford Local Authority, who were interested to get support to revise their primary school menus. And their target then was to make them more environmentally friendly. We convinced them that while we were doing that, why don't we increase the health of the food as well? So I'm going to present up to where we are today. So whilst we were developing these revisions, we set our criteria out up front. So of course, the new menus had to be compliant with the school food standards. They had to be tasty. They weren't allowed to be cost anymore overall. They of course had to be acceptable and feasible in terms of procurement and cooking. And we worked with lots of stakeholders. So we worked with a school food caterer, we worked with an organisation called ProVeg, of course with Bradford Council and their public health teams, schools and children, and we collaborated with another UKRI food systems transformation project called SNEAK, and I'll tell you a little bit more about why in a second. And then we decided to pilot this in 5 primary schools initially. And so we co-designed 12 new meals in total. 6 of these were completely new meals, so vegetarian meals, and 6 of them were blended meals. In other words, we looked at our data that we already had and we thought, well, these are the foods that children really enjoy. Let's try to make them better, but perhaps do that in a way that they wouldn't even notice. And the reason we've got this combination is that the blended meals are more likely to increase health of the diet, but actually the recognition that children do need to be exposed to different foods and different vegetables, for example. In terms of the children, we hosted a tasting workshop, and then for SNEAK, that we've worked with them to really think about what the menus are presented like, so the menu architecture. And you can do that in a number of different ways, but essentially it means that on any given day, whatever the child chooses, it will meet whatever criteria you want it to meet, whether that's cost, quality or others. So what we're doing then is we're implementing this, and we are exploring the impact on food choice and consumption. So we're looking at our photos, and we're looking at data on meal uptake. We're also doing focus groups with children, interviewing chefs, and we're thinking about feasibility in those interviews as well, and we're collecting some field notes along the way. To this date, we have collected baseline data, so before menus have been implemented, and each of the 5 primary schools, we go in on 3 consecutive days and we collect all of the photo data, very similar to what I've explained earlier on with the observational data. So it's about 200 children per day in each school, and we are planning on going back to them before Christmas. Next slide, please. So I'm just going to give you a snapshot really of what these new menus look like. And for this, we've chosen to look at saturated fat, fibre, carbon and cost. And the top few there are those popular meals that I said before that are blended. And on the whole, what that means is taking out meat and replacing it with beans or pulses. For the pizza, what we've done is we've changed the white base to a 50-50 base. We've also got a pepper that we've roasted and mushed into the tomatoes, and we've taken down some of the cheese from that as well. And what you can see from here is, on the whole, all of the blended meals meet all of the criteria, including the cost, which is often cheap because you're reducing some of the kind of animal products that go into that. The new menus also meet the criteria in terms of nutrition and environmental metrics, but do tend to be more expensive. Overall, though, throughout all of the meals, the overall cost is lower than what it was before. Next slide, please. Okay, so here's some pictures of our tasting event. This was a great day. We had 44 children from 4 schools, and they tasted all 6 of the new menus, and we also gave them the pizza at the end, which we said was just to keep them full, but we wanted to get an opinion on those as well. And we asked them to report each food using kind of a smiley face design, and we had a ball activity where they could give us a little bit more information in a more fun way as well. Next slide. Right, so what we're looking at here is what that data looked like from the tasting event, and probably no surprises here. The pizza was definitely by far the thing that they enjoyed eating the most, even though they didn't realise it was a completely blended meal. And we've got some variation in the other meals, but there wasn't any difference really in terms of whether the child was in Key Stage 2 or Key Stage 1. We have since therefore made some alterations to the ones that they didn't like quite as much, and we've got some information as well from the teachers that came with them and the chefs that also attended on the same day. And generally it was about changing texture, but we've changed some of the ingredients. So for example, if there were any that couldn't be easily procured. Next slide, please. Okay, so in terms of the menu architecture then, we sent all of our revisions with all of the nutrition information into the SNEAK team. They modelled over 1 million different combinations. And what you can see here are the combinations of what they would like each of the schools to serve. So for example, on the same day, they've suggested the beef burger with the loaded Mexican style wedges. As I said before, the idea being that it forces children to make a good choice. I'll say now these are not all popular with all schools. This is part of our learning. 2 have made some changes. 1 says there's no way that they can only put pizza on once a week. It has to once every 2 weeks. It has to be 1 week. But interestingly, most of the changes have been made to the school that wasn't able to come to the tasting event. So I think that really highlights how important that kind of involvement is. And like I said before, we're going to be going in and collecting follow-up data. So the new menus will be going into those schools after half term. So we'll be there doing interviews as well with the chefs and focus groups of the children. And fingers crossed, everything will be done and dusted before Christmas. Okay, I think am I going to you, Rob? No, I'm going to you, Nicola. Thank you.
So we were fortunate to have an FSA-funded student with us this summer who looked at the recent FSA school food standard compliance pilot in the context of our observation day data. So the pilot looked at the feasibility of using the food safety officers to monitor compliance during their usual visits using one of these 3 sets of questions, which our student tested against the menus in 18 of our schools and also against what children were choosing and eating in 11 of our schools. And this is what she found. The question sets only covered 11 of the 21 applicable standards, with important areas such as the provision of milk, dairy and protein not assessed. And without the ability to review the ingredients and preparation methods, it was really difficult to establish whether items stated on the menu were actually compliant. For example, potato wedges could be sliced potatoes simply baked in the oven, or they could be commercially pre-prepared or frozen versions, which are usually flash fried in a factory and then baked on site, and therefore restricted as a starchy food cooked in fat or oil. It was the same with looking at food served without some nutritional knowledge. For example, a pizza base made using whole wheat flour and water with a tomato sauce with extra blended pepper, topped with a suitable amount of cheese, as we've tried in the menu swaps, is very different from a processed pizza. None of our menus passed all 3 question sets, which is in line with the FSA report that many FSOs noticed non-compliance beyond their own question sets. And most of the menu cycles she looked at failed all 3 question sets. And it was really important to note that compliance didn't always mean consumption, with fruit being a prime example. It was often offered and therefore compliant, but not often chosen by the children. And nutritionally important vegetables, whilst being the most selected food, was also the most wasted. So I'll hand over to Rob now.
Thanks, Nicola. So as Summer's mentioned, my name is Rob, and today I'll be talking about the free school meal auto-enrolment component of FixOurFood. Next slide, please. So in England, free school meal entitlement is set at less than £7,400 per year, which equates to approximately 25% of children as of January 2025. And this is set to increase with the expansion of free school meals to families receiving universal credit. If entitled, families must apply, though approximately 11% do not, for many reasons, including literacy and language barriers and perceived stigma. As a result, children miss out on daily hot meals, and schools do not receive the associated pupil premium funding. And this is worth around £1,500 per primary aged child and around £1,000 per secondary aged child. Importantly, pupil premium can be spent on any pupil, not just those to which funding is linked, and therefore can benefit all pupils through improved teaching, academic support, and extracurricular activities. In the context of free school meals then, auto-enrolment refers to the processes by which local governments use welfare data sets to identify and register entitled children, applying on behalf of the families. Next slide, please, Nicola. So what were the aims of the project then? So working with our partners at Brennan & Co and the Food Foundation, we initially aimed to support the setup of auto-enrolment across Yorkshire. However, we were increasingly contacted by local authorities outside of Yorkshire. So ultimately, we aimed to support the setup of auto-enrolment across Yorkshire and beyond, and evaluate its implementation and impact. We also aimed to support the first cohort of councils to deliver auto-enrolment. And lastly, we aim to inform national advocacy and policy on free school meal registration. Next slide, please. To do this, the project contained 4 work streams: implementation support, implementation evaluation, and impact evaluation, with policy and impact activities embedded throughout. Next slide, please. In terms of implementation support, over the course of the project, we've engaged with 130 local authorities. We've also developed the FixOurFood network, through which local authorities can ask specific implementation-related questions and receive practical, tailored support. We also provided 4 workshops, and finally, we published the FixOurFood auto-enrolment toolkit, which contained a step-by-step process to setting up auto-enrolment, along with top tips and links to example documents. As of this year, the toolkit's been accessed. Sorry, can you go back, Nicola? Thank you. As of this year, the toolkit's been accessed over 300 times by local authorities, government organisations, schools, and third sector organisations. Next slide, please. To evaluate the implementation of free school meal auto-enrolment, we conducted interviews with 15 local authority stakeholders and 5 national experts. We also analysed 142 documents provided by local authorities, which included things like legal documents, meeting notes, and direct email correspondence. We also circulated 3 surveys, to which we received 186 responses. And what we found is that auto-enrolment emerged as a potential solution to support residents, increase food security, and address inequalities that sat within existing local authority programmes. In terms of barriers, there was initial scepticism around the need for auto-enrolment, which in one area in particular delayed implementation by 2 years, but ultimately resulted in over 1,500 additional children receiving free school meals once auto-enrolment was set up. Participants also reported problems accessing welfare data, issues with capacity and the financial resources to bring in additional support, and also legal concerns. While there were legal concerns in the beginning, it's important to note that national government have now provided clarity regarding the legality of auto-enrolment, but in the early stages, concerns were raised with regards to data use and GDPR, which in some instances stopped implementation completely. And lastly, in terms of facilitators, so senior leadership support was considered the primary facilitator, alongside external collaborations and sharing of example documents. Next slide, please. As of summer this year, we've gathered data from 85 local authorities, of which 35 had already implemented auto-enrolment, and a further 44 either exploring auto-enrolment or that were currently in the process of setting up auto-enrolment. Next slide, please. In terms of impact evaluation, data collected from 35 local authorities through data sharing agreements, surveys, and unofficial routes suggests that auto-enrolments led to an additional 22,597 free school meal registrations, which is great. Sorry, Nicola, can you click through the slide, please? Thank you. And in one area, at least 5 schools identified over 100 additional pupils. In total, these registrations have brought in an additional £27 million in pupil premium funding to schools across these 35 areas. Sorry, Nicola, can you click through the slide? Yes, thank you. And then lastly, and notably, I think only 1.3% of families opted out of this process. Of the children registered through auto-enrolment, 61% were from ethnic and minority groups, compared with 43% of total registrations. and 44% spoke English as an additional language, compared with 31% of total registrations, which suggests an overrepresentation of minority groups in auto-enrolment registrations. It is important to note that these figures are based on a small number of local authorities and may not necessarily represent the full, represent all local authorities. And then next slide, please, Nicola. And lastly, just to finish, here we have two quotes, one from a school teacher and one from a parent around the acceptability of auto-enrolment. So the first one is from a school teacher. If we think that parents are entitled to free school meals, then we would usually chase it up for them. We've had to do the paperwork because they can't do it. So yes, auto-enrolment has helped us. And then lastly, the quote from the parent. It saves you a lot of stress and troubles from your mind, not worrying that your child is going to school empty-handed. And that's the end of my slides. Hopefully I kept to time. I'll pass back to Sundus.
Super, thank you so much, Rob. So our work to date has had some tremendous impact, as has already been demonstrated, and we've generated many outputs. So to begin with, the holiday activities and food programme evaluation highlighted the positive impact the programme had on food insecurity and diet. So for instance, children ate a more varied and healthier diet than if they had not attended, and in some cases the meals provided were often the only hot, nutritious food a child would receive that day. Children also developed new skills due to the programme, including socialisation. They had the opportunity to engage in numerous activities, and parents were able to work whilst their children attended clubs. And finally, the findings fed into the 2021 budget for continuation of half funding by the Department of Education. Moving on, the Free School Meal Allowance project highlighted the inadequacy of the free school meal allowance for secondary school pupils to purchase a healthy, tasty and sustainable meal. Our findings also suggested that barriers were faced on how and when the allowance could be spent. For instance, only during the lunch period and not during break times, or in instances where you could buy a snack or drink at break time, meant that students cannot afford a full meal at lunchtime. Now, in terms of impact, not only did this research generate a collaborative report with the Food Foundation, but we've also published our findings in Public Health Nutrition. And Nicola, if you just click, and we organised with the Food Foundation a parliamentary event that was chaired and delivered by our very own citizen scientists and attended by 16 members of Parliament and 4 Lords. Next, we generated a report to highlight our findings for the early years mapping work in collaboration with Bremner & Co, which found severe underfunding and a lack of mandatory food standards within early years settings. And we've also produced numerous outputs for our free school meal auto-enrolment work, including research briefs and a commentary piece within Public Health Nutrition. Nicola, if you can just click her. Thank you, which have highlighted issues around auto-enrolment implementation processes, acceptability and impact. And we currently have 2 of the manuscripts in preparation. And finally, Nicola has published a scoping review as part of her PhD in PLOS One. Now, to access our reports, please visit the FixOurFood website or scan the QR code on the top right. Now, in terms of our next steps, so we're very much focusing on outputs right now, gathering and analysing the data from numerous different sources to communicate impactful messages around school food quality, consumption and systems, both independently and in association with other key factors, drawing on both our rich quantitative and qualitative data. Nicola, next slide. And finally, I just want to thank everyone for attending and just would like to acknowledge our collaborators and partners, the Food Foundation, Bremner & Co, our Leaders for Change and the Food Standards Agency, and everyone that's contributed to carrying out this work. Thank you. And we'll take questions now.
Right. Thank you so much, Professor Maria, Dr. Sundus, and Nicola and Rob for a fantastic presentation. Really interesting. So we can now take any questions. If you have any questions, please put them in the Q&A box, and we'll be happy to ask them to the presenters. Okay, I can see a few questions already. This is a question from Tara. She says, I wondered if you would be able to share which 5 stakeholders were the majority providers to the schools in Yorkshire. And she would also be interested to know if food fraud risk came up as a topic in many of the risk assessments through the procurement process.
I'm assuming that's one for you, Nicola.
Yeah,
Yes.
I was going to say, shall I take that?
Do you want to stop sharing as well, Nicola?
Yeah, I can do. So in terms of the I'm assuming that you mean which 5 commercial caterers were the majority providers to school rather than the stakeholders. I haven't actually shared who they are because some of the information was given to me on the understanding that I wouldn't declare that. So for the moment, I'm going to have to keep that confidential, I'm afraid. And if food fraud risk came up, no, it didn't actually. Nobody mentioned that. There was a slight concern by one of the local authorities, but they'd got processes in place. So there was a very small discussion. It wasn't a key finding.
Okay, thank you. Another question from Rhoda says, were you concerned about the over-provision of protein beyond the daily reference value? And if so, what were your recommendations regarding this?
So I think I'll probably try to answer that. So as I said, we haven't finished doing all of the data analysis yet, but this is quite strong. And this is driven primarily through meat or animal products, such as dairy. We did look at it to see whether it was sort of overconsumption of more processed meats, and I suppose you could see things like sausages as contributing to that. I think the answer is you should be concerned, given that the overall energy intake was under recommendations, but we haven't provided any outgoing recommendations specifically for that yet. This is just really trying to get a sense of what's actually going on in schools, because most of the data that we look at is what's being served and not what's being consumed. But I do agree that it is something to keep an eye on.
Thank you. Another question. So is one message to ensure children eat healthily to hide vegetables, etc. in composite foods rather than have separately in meals?
Shall I go for that one as well, because I presented that? I mean, I actually feel that our evidence shows us that both are beneficial. So we certainly didn't want to create new menus that totally hid vegetables, because exposure and repeated exposure to vegetables is beneficial for children. And we're trying to kind of foster lifelong behaviour, positive behaviour change, a positive relationship with food. However, we also know that nutrition from our national surveys isn't what it should be, particularly for children and particularly for those living in some of the more deprived areas. And so getting the additional nutrients into foods that they love, to us, felt like an obvious thing to do. And we certainly didn't want to sort of get rid of the pizza and replace it with vegetable stew, so because that just wouldn't happen, that wouldn't be feasible.
Yeah, thank you. And a question regarding the menu swap pilot. So in pricing the cost of the new menu, 12 items in brackets, did you also take into account any additional staff or labour time for preparation? Meaning, did the menu items require staff to spend longer preparing the food, or was it comparable to the previous menu?
Really good question. Sorry, I think that's me again. We haven't factored that in. This is just the cost of the food that I presented, but it is definitely something that we're going to explore when we talk to the chefs. They're already telling us quite a lot, by the way. They're not shy in letting us know what they will and won't do, and what they can and can't do in terms of their skills, their equipment, and really their procurement. And so we're gathering lots of information, but we haven't specifically got that information now.
The next question is, says, is it easier to change the food supplied by some provider groups than others? For example, local authority, in-house, or private companies, etc.
Shall I take that? Yes. So from the interviews, some of the local authorities told me that they'd got very rigid procurement processes in place, and so and also pre-ordering. So it was very difficult for them to change quickly, whereas some of the in-house chefs were more able to just use whatever was on offer or local. It isn't completely determined by the procurement contract type, but the characteristics are probably more common amongst some of them. Yes.
Yeah. Next question, were any considerations given to traceability and validation checks regarding the sources of products included in the menus? And given the cost is a significant factor, was there any assessment of the potential increased reliance on imported products and how this might impact sustainability and carbon footprint objectives?
Do you want me to go? Does anyone want to try that, or shall I just answer it? Well, try to answer it. That's quite a quick, tricky one. So we do work with experts in environmental sustainability, and it is kind of complex because, of course, just because something comes from far away, it doesn't mean that it's always worse for the environment, because it depends on what it is and how it's transported. So I think this is a really complex area we haven't specifically measured. There are some strategies that have been proposed in previous documents, like the National Food Strategy, for example, supporting local farmers in terms of contracting with the smaller businesses, basically, and smaller producers. But it isn't something that we are measuring. Ultimately, what we're doing is getting cost information from the caterer, which we hope factors that information in, and then combining as much data as we can, although I admit there are gaps, to estimate things like carbon and water use.
Thank you. Another question on traceability. Considering current challenges in school meal systems, what innovative approaches or technologies do you think could enhance ingredient traceability and help schools source healthier, more sustainable foods?
Do we know what that means by traceability? Is that the source? Do you think whether they're being produced? And yeah, Nicola, do you want to have a go at that?
Yeah, and I think that's one of the things that sometimes stops the providers being agile in terms of the supplies, because they'll quite often go through like bigger wholesalers, because they know that they've got that chain of traceability, and you know the foods are packaged and labelled with where they're from, what they contain, and it was brought up as a difficulty for those wanting to use like smaller local suppliers, how they could do that when those products, you know, like a carrot will come in a box. So in terms of being recommending what to do to overcome that, that's really difficult, and it's not something that we've looked at as part of this project.
Okay, thank you. I think we'll take one more question, and then for the rest of the questions, feel free to email them to us, and then we'll pass them on to the presenters. So one final question. Have you thought about working with EHOs in local authorities who visit school kitchens regularly and carry out food hygiene or standard inspections to have unique access to school kitchens and gather data for you?
Do you want to answer that, Nicola? It's related to the Food Standards Agency work.
Yes, they were part of the cohort of participants in my study, and we have done some work, and ideally we would like to do more work in that, but obviously that depends on being able to secure funding to extend the project, but we would love to do that.
And just to come in, so obviously it's going to build on what the monitoring process that was piloted, isn't it? So making most of people who are already into school. So it feels feasible, but there are obviously still gaps in what can be done.
The monitoring came out as one of the key findings that people thought that constrained the school food system being able to provide more healthier, better quality food.
Thank you. Okay, so that's all the questions we had time for today. And thank you once again to our speakers for a wonderful presentation. The seminar recording will be available via our YouTube channel, which will be posted in the chat. And this also includes recordings from previous seminars if you'd like to watch any of these. And before we close, I also want to flag that if you're not already on our Food for Thought mailing list and would like to join the mailing list, you can do so via the sign up link posted in the chat. And if you'd like to get in touch, please email us at foodforthought@food.gov.uk. If you're based at the FSA, you can find our page by searching for Food for Thought on the intranet. We're always open to ideas for future speakers. And if you'd like to get involved as a volunteer with the Food for Thought team, we'd love to hear from you. Thank you for today and have a nice rest of the day. Thank you.